My name is Peter Walker-Birch with another video podcast for Clinical Placement 1. Now, apologies for the delay in getting this particular podcast published this week. I've had a busy weekend, unusually for me. I was at a wedding of two very good friends of mine, which was lovely as the weather was fantastic. Now, I hope that you're all still having a fantastic time out on clinical placement. I've been on visiting lecturer duties this morning, so I've now managed to see all of my students. I hope that you've all had some sort of contact with your visiting lecturer. If you haven't yet managed to arrange your bipartite, can you please ensure that you contact your mentor as soon as possible? Failing that, get in touch with either the site coordinator or myself. I'll be visiting you all again very soon, probably in early September. So if you remember, can you bring your portfolios in with you next time that I visit, or whoever visits you? It will give you the opportunity to discuss any aspects of your portfolio with me or the visiting lecturer to ensure that you're still meeting the requirements for continuous professional development that will be required throughout your career as a radiographer. Remember to make as much use of any feedback you get from your 360-degree tool and weekly progress sheets. Highlight all the positive feedback, as this will come in very useful for job applications and job interviews. Now, I hope that you like the Medical Imaging University Challenge introduction. This was a very special request from one of the second year MSc students, and I thought that it would be useful for Clinical Placement 1, not least because it allows me the opportunity to devise another quiz for you, which will appear after this brief message. Now, University Challenge has been a massive hit since the 1960s. The more observant amongst you may have noticed that I have coiffured my hair, especially for the occasion, in homage to the great Bamber Gascoigne, who was the original and inimitable host of the show. Now, I have put a particular spin on this version of University Challenge. For those of you who don't get the cultural reference, Scumbag College and Footlights College were two imaginary teams from the Young Ones version of the show. If you have never seen the Young Ones before, I would look them up on YouTube. I used to love watching the show as a young teenager. However, it was every teacher's nightmare though, as the humour was very offbeat and anarchic. I remember my history teacher saying that he would never let his children watch such a TV show, as it was morally corrupting, which doesn't say much for me then. I will post the link to the Young Ones version of University Challenge for you to enjoy, should you wish. Now we are in academic week number 1, according to the module guide. The activities for this week were covered in last week's podcast as they relate to dose audits and diagnostic reference levels. Have any of you managed to look at the IPEM reports on diagnostic reference levels at all? What did you find? Have any of you started collecting dose readings using the DAP meters? If so, what have you found? Drop me a line or a tweet to let me know. Now, as I mentioned last week, Blackboard is going down this Friday at 6 p.m. and will be back up until Tuesday the 22nd of July at 10 p.m. So please ensure you access or download any materials that you may need over this period. Next week's podcast will be late again as a result of the Blackboard downtime. That said, it will give me more time to create the next podcast, which I'm hoping will be another quiz show on justification of radiology requests. So watch this space. If you have any requests for future podcasts, podcast themes, podcast content, just drop me a line or a tweet and I will see what I can do. Now, I'm officially on annual leave now until the 11th of August. However, I shall try and answer any emails or tweets as and when I can. If you have any urgent concerns or issues though, Sue Cutler is now the on-call academic for the next 2 weeks. Now, the quiz for this week is obviously based on University Challenge, and the theme is on alternative imaging and modified projections. Now, this should be useful revision for your tripartite. I know that Phil Cosson has already been in touch with you all about the tripartite revision session, which is taking place on the 15th of August. So you'll find out a lot more about the tripartite assessment then. Now, in this quiz, there are a total of 40 questions. Some of them might be tougher than others, but then you would expect a few tough questions on a university challenge type quiz. If you want to let me know how you get on with the quiz or how you are getting on in clinical practice, just drop me an email or a tweet as usual. I really do love hearing from you all. Anyway, I'll say goodbye for now, enjoy the quiz, and I'll see you next week. Goodbye. Right, your starter for 10, no conferring. What medical term is used to describe the difficulty in swallowing certain types of food and liquid, sometimes associated with odonophagia and often following a cerebrovascular event such as a stroke? Bonus question A. What fluoroscopic imaging procedure is often indicated to assess a patient's difficulty in swallowing? Bonus question B. Which functional imaging modality is usually indicated for the screening of bone metastases and to determine the extent of any metastatic disease? Bonus question C. What imaging modality is used to assess the risk of osteoporosis, usually in men over the age of 60 and post-menopausal women over the age of 50? Question 2. Your starter for 10, no conferring. What type of pneumonia results from the inhalation of stomach contents or secretions of the oropharynx, leading to lower respiratory tract infection? Bonus question A. What conventional radiographic imaging procedure is usually indicated in detecting the presence of intraperitoneal free air resulting from gastrointestinal perforation? Bonus question B. What two imaging modalities are normally indicated for adult patients with suspected osteomyelitis? Bonus question C. Following conventional radiographic imaging for internal derangement of the knee, what two follow-up investigations can be used to assess damage to the ligaments? Question 3. Your starter for 10, no conferring. ASB is an initialism for what triangular depression found on the lateral aspect of the dorsum of the hand, also known as the radial fossa? Bonus question A. What type of deviation is usually adopted for the postero-anterior projection of the wrist when a fractured scaphoid is suspected? Bonus question B. What effect does a 30-degree cranial angle have on the scaphoid bone when used with a postero-anterior projection of the wrist? Bonus question C. What radiographic projection of the scaphoid involves the hand and wrist being rotated by 45 degrees externally from the postero-anterior position? Question 4. Your starter for 10, no conferring. Anamnesis is an historical term more commonly known as what? Bonus question A. What conventional radiographic projection of the knee is often used in the trauma setting to visualize lipohemarthrosis in the soft tissues proximately to the patella, also known as the suprapatellar pouch or bursa? Bonus question B. What two modified projections of the knee can be utilised if a tibial plateau fracture is still suspected despite not being visualised on the initial AP and lateral projection. Bonus question C. An intercondylar or tunnel projection of the knee can be used to demonstrate what? Question 5, your start for 10, no conferring. What medical term, sometimes referred to as rickets in children, is used to describe the softening of bones caused by defective bone mineralisation as a result of a deficiency in vitamin D? Bonus question A. What radiographic projection of the ankle involves the internal rotation of the leg until the long axis of the foot is 45 degrees to the image receptor, used to demonstrate the talofibular joint and the tibiofibular syndesmosis? Bonus question B. What name is given to the radiographic projection of the ankle that is not a true anteroposterior projection, but is used to visualise the whole of the ankle joint without the superimposition of the fibula over the lateral gutter? Bonus question C. What rules or guidelines are used to help clinicians determine whether radiographic imaging is required for the foot and ankle? Question 6, your start for 10, no conferring. What does the acronym CRITOL stand for in relation to the Paediatric Ossification Centres of the elbow? Bonus question A. What modified projection of the anteroposterior elbow could be used to visualise the radial head? Bonus question B. What modified projection of the lateral elbow could be used to visualise the radial head? Bonus question C. Ideally, what are radial head projections trying to achieve? Question 7, your starter for 10, no conferring. Where would you find the sustentaculum tali? Bonus question A. Pes planus requires what kind of radiographic AP and lateral projections? Bonus question B. If a fracture of the navicular is suspected, what additional projection may be required to the standard dorsipalmar and oblique projections? Bonus question C. DP projections of both feet are required for the detection of bilateral erosions in which type of arthritis? Question 8, your starter for 10, no conferring. The AP oblique no-guard projection of the hand is more commonly known as what? Bonus question A. In determining the maturity of a child's skeletal system, bone age, which hand and wrist should be used for the DP projection? Bonus question B. When is a lateral projection of the hand normally indicated? Bonus question C. What radiographic features does the Bruton's anteroposterior axial projection of the hand optimally demonstrate in the assessment of rheumatoid arthritis? Question 9, your starter for 10, no conferring. What medical term is given to describe the fixation of a joint by surgery? Bonus question A. Identify 2 reasons why it is important to ensure that rotation is avoided on a PA projection of the chest. Bonus question B. Identify how adequate inspiration can be assessed on a PA projection of the chest. Bonus question C. If a patient over the age of 40 has hemoptysis, what radiographic projection of the chest is indicated in addition to the standard PA projection? Your start for 10, no conferring. Identify the 2 bones marked by a red oval and an orange circle that can be seen on the following radiographic projection of the wrist. Bonus question A. Identify the bone indicated by the pointed purple arrow in the following image. Bonus question B. Identify the following tendons indicated by the yellow and orange arrows in the following image. Bonus question C. Identify the cavity indicated by the blue oval and the prominence indicated by the red oval in the image below.